Oh, okay. Are you still rolling your rhomboid and still not getting any relief from doing massage, maybe some physical therapy and acupuncture, and still in pain? So today I'm going to show you one overlooking element that contributing to your chronic rhomboid pain. Let's come over here. Now, so I'm going to show you on the anatomy app. You can see on our mid back, we have, oh, let me just take this off. Now you can see. Now we have layers of musculatures in the mid back here and our upper thoracic spine. And for most people, they roll and massage their rhomboid and serratus, but they're not getting any better. And one of the main reasons, because that's not where the pain comes from. And I'm gonna show you one overlooking phenomenon that most doctors never talk about. Now, if you come over here, I'd like to show you this. You see this tiny nerve over here? It's called dorsal-scapular nerve. So this nerve is one of the brachial plexus branches, and it arises from the C5, C6, and you can see it travels all the way down to the scapula, and which can mimic pain in the rhomboid. Now, in order to address this, there's a muscle called posterior scalene, or scalene in general. It's laid on top of the dorsal-scapular nerve. So when this muscle is tight or hypertrophy, it will constantly compressing on a nerve. So in another word, what I'm really saying is you may be experiencing a dorsal-scapular nerve entrapment rather than rhomboid pain. So now I'm going to show you on the skeletal. Okay, let's follow me. So I'm going to show you my body here, and as I mentioned earlier, the dorsal scapular nerve arising from C5, C6 level of the vertebrae, and this is a C5 nerve, and dorsal scapular nerve will be traveling from here all the way down to the scapula, right here, and if the nerve is being compressed by the scalene, so let's say this is the scalene, posterior scalene muscle, and that can cause an impingement of the nerve, and the nerve will be irritated and you will feel pain traveling down to the shoulder blade. So now this is a crucial step, and this is how you can fix your rhomboid pain forever. And now I'm gonna show it on my model so that you can do this home relief on yourself for 10 seconds. Now, okay, have a seat over here. Okay, we're gonna have our model right here, and can you turn your head to your left? Turn to your left. No, your left.
Here?
No, turn your head to your left. No, left.
Oh, like that.
Like that, yes.
Sorry.
Now, so you can appreciate that she has, so this is the sternocleidomastoid, and this is the trapezius. Now I'm gonna teach you guys how to find the posterior scalene. Now, posterior scalene, it's located just right behind that bulge of the trapezius, so which is around this area. Now you can turn your head back to center. Now, so that's one way to find out if you find the Adam's apple and you draw a straight line and you find this bulk of muscles, and it will be vertical to the straight line, and that's the posterior scalene, and likely it's going to feel really tender and irritated. And so once you find that point, you can use your finger or maybe some massage tool like a lacrosse ball, just to compress on that muscle for a good 10 seconds. And 10 seconds later, you can roll on your shoulder blade, and likely the pain would be subsided or even gone away. Now, so some people always ask me, oh, so how can I stop the scaling from tightening up again? Well, that's a really good question. So let's come back here. I'm going to show you another information. So we're going to go back to scaling. And you can see we have 3 different scalings: anterior scaling, middle scaling, and posterior scaling. And these scalene muscles are attached to our first and second ribs. Okay, first and second ribs. So that indicates that these muscles are assisting our breathing. So I know that for a lot of people are breathing through their lungs, or we call it respiratory breathing. And in order to change the pattern of not using scaling is to actually shift your focus to a diaphragm breathing, or we call it diaphragmatic breathing. So for the next video, I'm going to be showing you and demonstrate how to properly use your diaphragm to breathe, so that you can have additional resources to help you to shift your focus. Instead of using your neck to breathe, now you can use your diaphragm so that you can totally eliminate that rhomboid pain forever. And I hope you enjoyed this video. And if you find this video helpful, and don't forget to like and subscribe and refer to some of your friends. And I hope that make some comments if you have any questions, or you have any comments about a video. And I'll see you in the next video.